Let's say the woman is pregnant. So what kind of life changes she should take? Maybe some eating tips, or maybe some vitamins, or activity. Maybe she should be not so active as she was before.
So, this is also very nicely described in Ayurveda. Once the woman becomes pregnant, so first 3 months are very crucial, very important, because anything can happen. She should be very careful not to get this miscarriage or abortion. This should not happen. So they have described that in this period, first 3 months, the female is very delicate. They have actually given an example, like there is a ball full of oil and you want to carry this from one place to another. So you don't carry it very fast. You have to go very slow and maybe go down the steps. You have to be very careful. So similarly, this female should be very careful while going down the steps, going upstairs, moving around. She should not be very active in the movements. And of course, at physical level, in Ayurveda, we also suggest to eat foods that will kind of like nourish the fetus, and they will make sure that the fetus stays there, it gets implanted properly, which primarily, it's, if we understand in simple language, not to eat heating things, foods which are very hot in nature. So more alkaline diet, more cooling foods, because heat is not good for this condition, especially the first 3 months. And it is important for the female also to take diet which is rich in iron, folic acid, and of course all the minerals, calcium especially. She should drink milk. She should also eat green vegetables and fruits. So this is advised in Ayurveda. We also suggest eating Chyawanprash, it's very nice tonic. So she has to make these changes for sure. And also, because this is a new experience for the female, she must be taken care by the family, again very important. She must, it's not that now she has become pregnant, so many times the man thinks, the husband thinks, now my job is over and he is busy in his work, but no. All through the pregnancy, during birth, postnatal, always she needs the partner there, because it's a combined product they have produced. It's not only the female, female is only carrying it, but it's also a part of the husband. So at this time, emotionally she needs lot of love, lot of care, because she is going through many changes, and which affects her physical, her digestive system, her mood, these are affected. So she needs lot of love and care at this time, and she must be taken care properly.
Let's talk about morning sickness. I hear that many pregnant women, especially first months, they experience quite big morning sickness. How they can help in Ayurvedic way?
Yeah, of course, this is a normal thing. This is not a disease. We don't call it a disease, because when the body is going through these changes, there are certain kind of like situations. She gets like vomiting sensation. Sometimes she gets some acidity. So there are quite few things we can do in Ayurveda. Very nice is fennel. You can have fennel tea, is good, or you can just eat fennel seeds. You can also grind the fennel, make a powder, and just 1 teaspoon, put it in cup of hot water, put it for some time, and then you can drink it slowly. Lemon helps instantly. When you feeling like nausea, take a small piece of lemon and put some little salt, maybe black salt or normal salt, and you just lick it slowly. So this makes your mouth little better, taste becomes better. Also ginger is very good. Fresh piece of ginger can be taken, just chew it, or again with some lemon you can put it in the mouth and you just chew it. This is also good. Of course, in Ayurveda we also have some specific medicines which are given especially to keep the heat down, or keep the pitta down, because when it's too much acid or there is some kind of pitta in the stomach, then it is more like feeling of nausea and vomiting. So this is how it can be taken care. It's a normal thing. It happens to majority of the women when they become pregnant. So, it should not be considered like some disease and take too many medicines for that, try to do natural things.
I would like to ask some intimate question. I know that when couples are trying to conceive, they really try to have sexual interaction quite often, let's say every 2-3 days through all the month. What Ayurveda says, is it does it recommend to hold up before such an event?
Yes, first of all, there is no point trying for a whole month, because there is a special time which is called the fertile period, when the egg is ready for receiving the sperm. When the egg is not there in the womb, there is no point, the sperm will go and it's going waste. So, of course, it is not all the month, there is some time according to Ayurveda, like when the menstrual cycle finishes. So, from next day till the 14th or the 15th day is the period, is called fertile period. So, during that time the couple should try, not necessarily every day, they can try like every alternate day or maybe 2-3 times during that period they can try. And yes, to just preserve this dhatu, which we call Shukra dhatu, it is good, if you preserve it, it becomes more strong, it becomes more potent. If you lose it very often, then it becomes weak, because this is also the last dhatu. There are 7 dhatus and this is the last one. So, sometimes we also consider that this is the essence of all the dhatus. So, it is kind of like a very precious fluid or reproductive tissue and should not be wasted just like that. It should, more you preserve it, the more potent, more strong it becomes. That is how we understand in Ayurveda.
Let's talk about preparation for birth. Let's say the woman is pregnant 9th month. What kind of life changes or diet recommendation or just for mind recommendation could you give?
Well, specifically when it comes to diet, in Ayurveda we have description of monthly regimen. It is very nice, every month they have described, first month what should be the diet, second month what kind of changes, third month what kind of changes. So, I will advise those of you who really are very serious about this topic, you should definitely read this. You can always email to Jiva and we will send you the details. But in general, the whole idea is that when the fetus is growing, so at various times of the pregnancy, different organs are developing, different things are changing. So, accordingly we have to change the diet. Secondly, considering the mother, also there are many changing happening in the mother, like I said, we say that first trimester is 3 months, is some kind of diet we have to take, because it is more nourishing, more trying to implant the fetus. Then next 3 months, the second trimester is when the growth happens, and the last trimester is more we are preparing for the delivery or of the child, you are preparing for the childbirth. So, there are certain things like constipation you have to address, sometimes hypertension, high blood pressure you have to address. During pregnancy, some females they also get thyroid problems, they get diabetes sometimes. So, all these things should be managed properly, and one should prepare for this, should have a knowledge for this, and at psychological level she has to start preparing about this fact that she is going to be a mother. This is a new thing for she has never been a mother before maybe, and this she has to learn to develop the bond with the fetus, with the child inside, although the child is not yet born. So, it's something you have to learn, because more strong the bond between the mother and the fetus or the child inside, the more strong mentally, psychologically the child will remain when he is born, because this is now where all the things that mother is thinking, what she is watching, what she is hearing, what she is talking, all this is going into the child's subconscious mind, and this is very, very important. If mother is watching some wild movies or some violent things, or she is listening to some very crazy music, so the child will become very disturbed by that. So, we call it like sattvic music and sattvic lifestyle, Spiritual temperament is very important. The mother should develop a spiritual temperament. She should read some spiritual books. She maybe chant some mantras, she can do some meditation, physically also some exercise, some yoga. This is very, very important, Everything is very, very important during pregnancy. The mother should be very, very, very careful about not doing things which could harm the fetus, which could harm the child, and definitely no smoking or drinking and doing all those crazy things which many pregnant women do even now. This is not totally advised by Ayurveda.